I experienced my stroke in April of 2020. I had a really, really bad headache, like the worst pain I've ever experienced. And then we got in the car.
And we were driving down Highway 6 at Rock Prairie Road, and Kyler turned to me very confused, and he said, Mom, did you put me in the car? How did I get in the car? And this didn't make any sense. And then he said, I have to throw up. And I thought, well, that's weird. He was just normal a second ago. They diagnosed Kyler as having a severe migraine headache. And I get migraines occasionally, and he was so confused. It didn't seem like a severe migraine to me. And the doctor was like, well, if you don't think it's a headache, you can drive an hour and a half to the Woodlands and have them check him out at the hospital. And Kyler and I drove at normal speed, to the hospital.
Going down the road, I just forgot everything, who I was, everything, and I don't remember anything after that.
And when we got there, he was crying, he was very confused, very wobbly, and they said, well, we want him to pee in a cup because they're checking for drugs. And I'm like, no, there's something really, really wrong with him. Okay, look, here, we'll pee in the cup, but that's not our problem. They did a CT scan, and within less than 5 minutes of that CT scan, they came back and they started working on Kyler. And the woman just grabbed my hand and she said, your son has a mass in his brain and he's bleeding in his brain and he needs emergency surgery. It's very serious. They transported us via ambulance to the main hospital at Texas Children's, and he had surgery. And I'm asking them, is he going to be okay? Is he going to be himself when he wakes up? Because when you have a hemorrhage, blood and brain don't mix. And that's one reason why we're trying to get the word out about pediatric stroke, because most doctors don't think stroke, and so we need to educate the public so it can be one of the first things that comes to mind, because Kyler was very, very lucky. If I had taken him home and put him to bed, it would have been a much different outcome than where we are right now. And they did emergency surgery on Kyler. They put in a shunt because when you're bleeding in the brain, you have more fluid in the brain, right? And so it's expanding and there's not enough space. So it's hydrocephalus, brain swelling. And so the shunt was put in to relieve the pressure and to kind of help drain out the blood, which is mixed with the spinal fluid. So I kept asking, is he going to be okay? And you just don't know. You don't know because everybody's brain is unique. And we had to tell him repeatedly what happened. Why am I here? What's happened? And it's just so disheartening. Every time they ask the same question, your heart drops. This is somebody who has dementia, because it's not sticking. And we were trying to get him to eat something, I remember, the next day. And I had ordered a thing of Lucky Charms, and I held up a star, and I'm like, what's this? It's a star, just trying to get anything from my kid. And I held up a heart, a Lucky Charm heart, but I held it up upside down. And Kyler goes, it's a butt.
Next thing you know, I'm in the hospital with a tube coming out of my head. It's a shunt, and it's draining spinal fluid. I was extremely scared, very scared. I thought honestly that only adults had strokes. Yeah. I had no idea a child could have a stroke. I don't think my mom knew a child could have a stroke. Did you know?
Yeah.
No, I didn't know. So
when you have this sort of thing happen, there are certain procedures that they do. They do an MRI. They do something called an angiogram, and they're checking to see, what is this mass, right? And can they take care of it? Can they remove it? I'm just asking questions and nobody will tell me anything. Nobody will talk to me. And the doctor's like, I'll walk out of the room. And this one doctor, this lady doctor, she comes back to me and she said, they're not going to tell you, so I'm going to tell you. She said, because it's not right for you not to know. She said, you can't fix this. This isn't going away. And then you just need to be prepared, and you need to prepare yourself. She said, this is an AVM and it's too big. And she just turned and walked out of the room, And that was when I realized that this was going to be a really long journey. So what an AVM is it's arteries, which are very, very high flow, right? That connect to veins, which are very low flow. And arteries take blood that's oxygenated right, from the heart to the body, and then veins take blood that is the oxygen is all used up, right, from wherever it is in the body back to the heart, right? That's how we work. But arteries should never connect directly to veins. There should always be a capillary system, like those really thin, fine capillaries. And in a brain AVM, a gene screws up. So the arteries connect directly to the veins, so you have high flow to low flow, and eventually, you know, it can't sustain it, and so it ruptures. So Kyler's arteries are, I think they told me, 10 times their normal size in his head. They're just like stretched to the max because we're high flow to low flow. It's not hereditary. There are other conditions that there's called like HHT and RASA1 that can be hereditary, but for the most part, as like in Kyler's case, it's not a hereditary thing. It's just a random thing that happens at 8 weeks gestation that you don't know about. Nobody knows about. And the way that most AVMs are found is just like Kyler's. It's when they rupture. And the average age of an AVM to rupture is 17. And Kyler's ruptured at age 15. And his AVM is 3.5 centimeters by 3.5 centimeters by 6 centimeters, which is about the size of a hen's egg. And when you have AVMs, they're graded, and they're graded a 1 to a 6, okay? And usually you can treat a 3 or less and be pretty successful. It gets a lot more complicated when you get above a 3. And Kyler's has been, some people say Kyler's is a 4, some people say Kyler's is a 5. There's different criteria, and of course everybody, you know, has their own opinion for that. So with brain AVMs, there's 3 ways to treat them. Obviously the first thing, a brain AVM is known as a ticking time bomb. So it just explodes without warning. That's what they're known of in the community, in the medical community. And a 1 or 2 or 3, usually you can go in and safely remove, and that's what you want to do until it's gone. It can rupture again and cause another stroke. When you get higher than that, there's other choices sometimes. One is called embolization, and Kyler's actually had 1 embolization, and it's really neat what they can do. Technology and doctors, they go up like a, you know, you've heard about, they have a catheter, like when you go in and check the heart. Only it goes all the way up through the carotid artery, actually into the head, and they stick crazy glue. Sometimes you can do onyx too, and that crazy glue then kind of occludes the artery so that the blood isn't flowing there anymore. Now, bad things can happen, right? It can stop, and then it can rupture. So it is a bit risky, but that is some things that you can do sometimes to treat AVMs. The reason why we can't really do that to treat Kyler's is because that blood that's flowing through the AVM also goes to something that's called eloquent tissue, or good, happy, healthy tissue that Kyler needs to function, right? To be able to move his arms and his legs and all that. And so we can't embolize it because then it would kill surrounding tissue that we need, that Kyler needs. So when we left, Kyler was so lucky. He is very, very blessed, and he actually walked out of the hospital at Texas Children's 8 days after his stroke, and that is just unheard of. It was because we caught it early, and it was because the blood bled into, from where it ruptured, it bled into a ventricle. But they said, your AVM is too big and we cannot help you, so you cannot come back. And I love Texas Children's, they saved his life. And they were being honest to say that they could not treat Kyler. We actually interviewed 16 neurosurgeons across the United States and 1 in Germany. And it's really hard for a parent, because it's kind of like a choose your own adventure book, but you're playing with somebody's life. And I could not, you know, I don't want to put my kid to sleep and say, okay, we're gonna have surgery now, go to sleep. And when you wake up, it's not gonna be like when you went to sleep, right? You don't wanna, I can't take anything away from him. And what you have to understand is you only get 1 brain. I mean, there's 1. So on the choose your own adventure books, I can say, ooh, that didn't work out right. I'm gonna turn around and go to page 33, because obviously page 42 is not the right way to go. And you can't do that at all with the brain. I mean, you have to be dang sure, because whatever you do, it's permanent and it's forever. I started a cure for Kyler, because that's what I was looking for. I was looking for a cure for Kyler, and just really got involved in the community, and started saying, well, you know, what did you do and where do you go, and doing research. And we found out that UCSF, which is in California, the Beinhoff Children's Hospital, is the #1 in the country for neurology and brain AVMs. And TAF, which is the Aneurysm and AVM Foundation, which I didn't even know existed, right, helped us. They reached out to me and said, hey, you're making a big enough splash in the online pond that we want to let you know we can help you. We can help you navigate through this diagnosis. And that's what people need, because no parent wants to know if their kid has a ticking time bomb in their brain. I mean, I saw what happened the first time his AVM ruptured, right? And now
it was a microbleed.
It was a microbleed. Yeah, it was a small one, and you know, it's the stress is unimaginable, and so we sent everything to UCSF. And they said, we're going to tell you about gamma knife radiation. And it's focal radiation on a particular point. And originally they had said that some of the doctors had said that Kyler's AVM is way too big for radiation. And the reason why is because it would require so much radiation that it would cause, you know, permanent damage. And what UCSF said is, yeah, that would normally be true. But what we're doing is, we're hitting the AVM in different stages, which nobody wants to radiate their kid's brain. Remember, you only get one. And then have it kind of hopefully shrink down enough that that it could later be removed if it was not obliterated. So Kyler had 3 rounds, which was done every 3 months, of radiation. And then, like, the reason why parents are like, hey, we don't like this, is because then you have to wait. And it can take, you know, 3 to 8 years to see if the AVM shrunk enough that you could remove it. And then you have side effects, right? So again, we're back to, when you get this diagnosis, you're walking down the path of trying to figure out what is the lesser of 2 evils, right? Do I do something where he can lose part of his vision, or if I monitor it, it's going to rupture, it's going to bleed at some point, don't know when, and then we get hemopneumplasia, which is the loss of half your vision in both your eyes, but it'd be like this. I mean, can't drive, right? So after his 3rd round of radiation, Kyler developed epilepsy, which we knew. They told us he was going to become an epileptic. However, they said that he would probably become an epileptic anyway if you did nothing, because of where the AVM is, which is in his parietal lobe, and it borders his occipital lobe. So that's why Kyler's vision is very, very significantly at risk, among other things.
Right.
UCSF, Beinhoff, agreed to treat him. And some people, which I want to talk to you about really fast, are like, well, I don't want to travel for treatment because that just makes everything so complicated, right? And I've said, yeah, but you only have 1 brain, right? And they say, but it's too expensive. I can't afford to travel, right? And so I want to let people know that there's things called like miracle flights, and so don't think it can't happen, right? I feel like my grandmother always told me, where there's a will, there's a way, right? So you can apply to programs like miracle flights that will fly you for free to the specialists for treatments. There's groups like the Ronald McDonald House, and for us, Family House. And Family House is just such a warm place. I could just cry thinking about it, because they took care of us and we didn't have to pay. And they were right there, right close to the hospital. So if there was a medical emergency, I mean, they were great. And there actually was. Kyler started having seizures while at Family House. I mean, and they had an ambulance there, and they had him at the hospital within, 4 or 5 minutes. And of course, we didn't know, that was when he was first diagnosed with epilepsy. We didn't know what was wrong. We just knew that our kid all of a sudden couldn't talk. Well, when you think about stroke and pediatric stroke, you really want to remember the acronym BFAST. BFAST is balance, eyes, face, arms, speech, time to call 911. Okay, and when Kyler has focal seizures, and there's all different kinds of seizures. Like whenever I think of seizures, I think of something that's a tonic-clonic seizure where you shake, right? Kyler didn't have shaking. That wasn't his thing at all. All of a sudden, he could not speak or understand language. And that tends to happen sometimes with stroke as well. It's like he knows how to talk. The best way I can think of it is, if you ever go to sleep and you're dreaming and you can't read, you know how to read, right? But that part of your brain doesn't work when you're asleep. And so you can see numbers, or you can try to write numbers and you can't, or letters, and you can't do it because that part's not there. And that part just kind of blinks out for Kyler when he's having a seizure, and he loses the ability to talk, and he loses the ability to understand what someone's saying. He can know that someone's talking to them, but he can't understand their words. Kyler had to have chemo, so that was not expected, but everybody's brain reacts differently. And so sometimes when you go in and you have radiation, it causes a little bit of swelling, and that's normal and expected. But just like everybody's different, everybody reacts different to medication, right? Everybody reacts different to radiation. And unfortunately, or maybe fortunately, because maybe that means it'll have a better chance of shrinking, Kyler's brain went, radiation, I'm gonna overreact. And his brain,
marshmallow.
Yeah, marshmallow. And so Kyler's brain started swelling, and we couldn't get the swelling to stop. And you know, it's really important to have your left brain stay on the left side and your right brain to stay on the right side, right? And midline shift is when you get so much swelling that the brain shifts over, and that can be deadly. That is very, very dangerous. And in December, Kyler had a midline shift from the brain swelling. We went in every 2 weeks, and it was called Avastin. And the Avastin chemotherapy definitely saved his life.
Yeah, and the worst thing about that is they're telling you, like, we're about to give this to you, right? And when I'm laying down on the table, I'm like, okay. And then next thing, they come in like hazmat suits, and they have like the shot, and they're all wearing like suits so that it doesn't affect them. And I'm laying on the table, I'm like, you're gonna give me a shot, right? And like hook it up to an IV, and you're wearing hazmat suits. And because it's chemo, and I'm like, wow, must be really bad for me.
Everything is before the stroke and after the stroke. And life is different. I mean, very, very, very different for somebody overnight. Things that you used to be able to do with no problem at all, it's gone.
When I go to a theme park, I sit in a wheelchair because it's really tired for me to walk around. I'll pass out or something, and it's really hard because I go to the theme park and I see everyone go on the rides, and I'm just like, I can't ride anything really. I rode like some kid minion ride, and Sam can even ride that ride. So me and Sam rode that ride, but
he didn't have any other children who had a stroke to talk to, so he felt so alone. And so he told me that he wanted to be sure that any child that he found that was in the hospital that was going through the same thing, he wanted them to know that it was going to be okay, because that kind of reassurance would have meant so much to him.
I've talked to lots of kids. I message them, and I talk to adults too, because they're also scared.
When you have this diagnosis, you feel like you have no control over anything, right? Especially when it's like really hard to treat and there's no guarantee of anything, and and it's like, okay, we cannot live our life focused on what we have no control over. We're going to focus on what we do have control over. And what we have control over is educating other people. The number one cause of a brain bleed in a child, excluding trauma, like, they fall, they hit their head, whatever. The number one cause of a brain bleed is a brain AVM. How are our parents not being told about these things, right? And so that's something we do have control over.
Some doctors.
They don't think about it.
Or they don't
So
know.
when they had Kyler pee in the cup, right? drugs, something like that. That's what most people think of. And if you look for adults who are stroke victims too, that's one of the first things they ask is like, well, did you take drugs? And I'm like, no. We really need to put more focus and attention on stroke. Money for research, for treatments and cures goes to other things because there aren't as many people that have this condition. And so that's why we started AVM Alliance, A Cure for Kyler and Friends, and we're going to spread awareness. We're going to let everybody know about pediatric stroke, and we're going to try to find a cure. And so we're going to raise money to try to find a cure. And so that's what Kyler has been focusing on.